I'm worried that she thinks that we've abandoned her.
Leila Emery says her 76-year-old mother has been locked in her room 24 hours a day since mid-November, when an outbreak was first declared at Menno Home. Sandy Roberts is hard of hearing and can't communicate virtually.
It feels like they're in a prison, right? Like they're locked inside their room. They cannot leave. They cannot have visitors. And I just feel like I don't think she's the only one, but are probably experiencing loneliness, hopelessness, abandonment, rejection, sadness.
42 out of 45 residents have tested positive for COVID-19 at Menno Home. 12 residents have died. Across the province, 51 long-term care, assisted living and independent living facilities are on lockdown due to active COVID-19 outbreaks, meaning hundreds of seniors have been locked in their rooms since November. And staff are stretched thin when residents get sick and need more care.
People may be more rushed than they were before, so for instance, if someone, with cognitive impairment this is just an example, may need coaxing to take their medications, and so maybe it takes a bit longer to get them to take it. Maybe you don't have that time.
Seniors advocates say the full impact of isolation is immeasurable.
People who are basically just dwindling away because they've lost hope, they're depressed, they won't eat, they haven't seen anyone who loves them for months. They've started not to recognize their family if they do get to see them because they've seen them so seldom. Those kinds of issues can't be counted or kept track of.
The Ministry of Health says 1,200 additional staff have been hired so far. With current outbreak protocols, residents living in facilities with active cases like Menno Home could end up living in total isolation in their rooms for nearly 3 months.
The fact that we can't talk to her on the phone makes me sad, obviously. I just think it's a lot of isolation.
Eva Uguen-Sange, CBC News, Vancouver.